just a play that's as emotionally fluid as Chekhov as this one, as Vanya, to stage it with us as much a part of the set as one can be without actually having to learn the lines is an extraordinary bit of staging. I can't sort of not take my 15 seconds of being a critic and just saying that. When Raphael asked me to talk about me and Chekhov, I'm a neuroscientist, a psychiatrist up at Columbia Presbyterian. I'm also a playwright, and I've been doing both for all my life. When Raphael asked me to talk about me and Chekhov, I think it's a bit like asking a composer to write about me and Mozart, or a theologian to write about me and Mohammed. It's absurdly daunting, and I'm going to take it literally just for a little bit, if you'll sort of go with me a little bit on that. Chekhov was born in Taganrov, which is on the Sea of Azov. I was born in Brighton Beach, which is right next to the Sea of Coney Island. So we have that in common, me and Chekhov. And the other thing that we have in common is kind of troubled childhoods, or at least somewhat traumatic childhoods. Stephen King, in his book on writing, talked about that if you're going to be a writer, it's good to have manageable trauma in your childhood. He sort of talked about it as an oyster with a grain of sand in its maw. That if it's something that's there and you can't get it out, you keep masticating it, and you come up with a pearl or not, but that it's there, kind of causing great. It's a great cast. Causing kind of a background noise that never quite goes away. Chekhov had that, and his whole family dynamics, in part that he had 4 grandparents who all died when he was a young boy. 2 uncles died. His 2 brothers, one was morphine, alcohol addict, also got tuberculosis and died quite young. So both brothers were addicts. The family, well, they lived again on the Sea of Azov. They lost their wealth fairly early. Their modest wealth. They were certainly modest means, and so poverty came on Chekhov at a fairly young age. So the sense, and also the sense of not being aristocracy in the Tsarist Russia, it was you were very much an outsider. If you sort of wanted to advance, there was a very, very real sense of inside and outside, and Chekhov was definitely a sense of himself as an outsider. And then the other thing that Chekhov contracted, as you probably know, when he was 24, he coughed up blood, and he was in medical school at that point. And as a doctor, there aren't that many. The diagnostic differential is not that great if you cough up blood. There are a few things you could have, but tuberculosis is right at the top of the list. And in 1884, when he started coughing up blood at the age of 24, tuberculosis was basically a terminal diagnosis. And so he was living with the seeds of his childhood plus the sense of death very, very powerfully within him from a very young age. I mean, he knew he was not going to live much into middle age, and indeed he didn't. Just to go back to me and Chekhov, and then I'll drop that sort of thing. I lost my mother when I was 7, which obviously I think that was a bit more than Stephen King had in mind in terms of a manageable trauma. But again, it's one of those things that it gets in you, and you can't quite get rid of it. And I think Chekhov and I both, I think, went into medicine. I'm going to talk about medicine now in terms of Chekhov as a doctor. people go into medicine for all kinds of reasons, all kinds of reasons. I think one of the reasons Chekhov went into medicine was because as a young and smart man, obviously brilliant man, but who was not in the aristocracy, there were just so many ways you could sort of advance yourself in Tsarist Russia. Medicine and law were one, but also the thing was that there was a lot of people were dying around him. His uncles, his grandparents, his brothers were ill. And so that the need for medicine, I think, it wasn't just, it wasn't a passing fantasy, and it wasn't just to make money. And I think for me as well, in terms of trying to figure certain things out from my childhood, I think medicine became something that I had to do in terms of understanding something in my life, as I think Chekhov did. And that's going to just to jump way in terms of Astrov. Astrov is not it's not emotionally Chekhov, but there are certain pieces of Astrov that are extraordinary in terms of they come straight out of Chekhov's life and out of some of his adventures, if you will. I'm going to jump ahead because I think it's late for all of us. But in 1888, Chekhov got the Pushkin Award, which was a huge award in Russia for a writer. So basically, he started writing when he was 20. Was published a lot, like hundreds of short stories while he was in his 20s. Was extremely successful as a short story writer. In 1888, won the Pushkin Award. In 1889, his editor, who was a man named Savorin, who was sort of the equivalent of William Hearst, Randolph Hearst today, had said to him basically, "Why don't you just drop medicine and just concentrate on being a writer?" And I think that the assumption, I think, well, and Chekhov wrote this letter back basically saying, medicine is my wife and literature is my mistress, and I wouldn't dream of giving up either one because my life is much more interesting now because I can flip-flop from one bed to the other, and I'm not really doing any harm to either one. That's a paraphrase, but that's more or less what he said. But he was quite serious about the fact that there was no way he was going to give up either one of these. I wrote a screenplay which was optioned, which hasn't, if any of your Hollywood producers and you want to produce, I have a wonderful screenplay for you, that it's available. And when that happened, it was Penny Marshall's studio optioned it, and nothing happened. Everyone said to me, "Well, are you going to give up medicine now?" And it was like, no. I mean, it's like you don't understand me if that's what, it's not a day job. It's like, it's a part of my life that I need to be able to understand myself as well as to be able to heal. And I think Chekhov clearly had that, and it clearly comes out in Astrov, as well as in any number of his other plays. And I'm really going to try and wrap this up here. But in 1890, he wrote a play called The Wood Demon. It was Chekhov had one huge failure in his life. It was The Wood Demon, or one dramatic failure. It was The Wood Demon. It was produced in Moscow in 1890. It had 2 shows and it closed. It was critically, it was panned. The audience hated it. It was extremely long, had many, many characters, but it was Uncle Vanya. And basically, after Chekhov put The Wood Demon aside and took a trip across Russia to Sakhalin, which was the Russian penal colony. And this is a man who's fairly close to death with tuberculosis. He travels the entire length of Russia, goes to Sakhalin, basically becomes a medical epidemiologist and sociologist, writes this book about the penal colony, comes back to Russia, comes back to Moscow in 1892, buys a farm, sort of like Astrov, and it's an estate, it's a farm, it's got a forest. He talks about managing the farm. He's not a gentleman farmer. He's a real sort of farmer, a real manager of the forest. And he also is a serious doctor. This is just before he's about to sort of sit down and look at The Wood Demon again and rewrite it as Vanya. And there are just 2 quotes I want to give you, and then I promise we'll stop. One is, and this is again to Savorin, his editor. I have been busy being sole doctor of the district and trying to catch cholera by the tail and organize health services. So he's kind of becoming an epidemiologist, sort of a social, an organizer of medicine. I have in my district 25 villages, 4 factories, and 1 monastery. I don't know if you remember, but Ostrov talks about a monastery in one of those in the map. And in the morning, I receive patients, and in the afternoon, go on house calls. So this is his day. This is in 1892. He's now, he's 12 years before his death, and this is now 4 years before he's writing Vanya. He's seriously into medicine. And also, he's seeing all these patients. He's not taking any money. He does not charge his patients money from this point on. From when he started making money as a writer, he stopped making any kind of billing as a physician, which is kind of amazing. And then he says one other thing, which really sort of got me, and this is again just before he's about to write Vanya. He says again to writing to Savorin, his editor and publisher, a little girl with worms in her ear, diarrhea, vomit, syphilis, sweet sounds and poetry. Where are you now? So basically, he's practicing medicine, and part of the thing about medicine in the late 19th century was trying to maintain the Hippocratic Oath of do no harm is very, very difficult because basically we didn't have anything as physicians to offer people, very, very little. Surgery was... Astrov talks about his patients dying on the table. That was extremely common. And even if they survived the surgery itself, they usually died of infection because there was no antibiotics to treat them with. So it was a very, very grueling and emotional trip to be a doctor because you see these sick people and then you have really nothing to, you can sort of, you palliative care, but you really have very, very little to offer anyone. And that's what he was doing just as he's about to write Vanya. So... I guess what I'll stop here, but basically what I wanted to say was I think you have to see Chekhov as one of the great playwrights, up there with, well, you name it, but up there with anybody in terms of a brilliant playwright, but also a deeply dedicated physician for whom medicine was a way of looking at the world and being as a physician was a way of looking at humanity. And the other thing and then I really will stop, was that this play is not about good and evil. It's about people who are sick or stuck or unhappy or depressed or internal or can't get something out. But it's not about good and evil. There's nothing political in any of Chekhov's plays. It's all. I don't think. They're all about humanity. They're all about humankind as sick or healthy or able to act or unable to act or stuck or not stuck, but not good and evil and not politics. And I think, again, that comes to a certain degree, at any rate, I think, from his identity as a physician. This is a great evening, Raphael. Thank you very, very much.
Thank you for staying.
Thank you.